An estimated 1,800 patients are released from the Guam Memorial Hospital emergency room every month, a number that could decrease once an urgent healthcare center is established.
I'm hoping that once we start this, we can see those numbers reducing at ER. You know, from 1,800, we go to 1,200. And if that actually happens, then we're achieving one of our major goals.
As a member of the Urgent Healthcare Center Planning Committee, GMH Chief of Environmental Services Gordon Mizuzawa is one of the dozen of healthcare professionals who have to first decide where to put such a facility as provided through Public Law 32-60 passed earlier this year. GMH Administrator Joseph Verga says committee members toured both potential sites last month.
That'll kind of drive the operational aspect, it'll drive the staffing, it'll drive the budget, you know, all of that, and so there's kind of thoughts that this should be separate. Two options on the table. One, operating it within the old ICU here, kind of separate from ER, and another recommendation is to make it either in the ER annex or as part of the new ER facility when the whole thing is completed.
Member Chuck Tanner.
If you put it there, you're going to confuse patients. If you have it separate, it's its own separate identity, its own separate management, its own separate books, its own separate everything.
Meanwhile, Dr. Felix Cabrera says there's another option on the table.
What's wrong with an ER fast track? If the urgent care serves as that, it's still within the intent of the law, and it still satisfies the need. It decongests, you know, what we're complaining about and what we're worried about. And so, I feel like I'm still kind of on the fence about where it should be, but I am leaning toward it still being in the ER annex, just because logistically I think it just makes sense.
But members can agree on one thing. They're concerned about residents abusing an urgent care facility for primary care. Assistant Nurse Administrator Gemma Simbillo.
It's going to help to decrease the burden on the ER and save it for true emergencies. At the same time, it's going to help to streamline all these frequent flyers, you know, and try to place them where they really belong.
Verga says members will vote on the urgent care facility location at their next meeting scheduled for October 15th and finalize plans by January 2014. Reporting for Guam's News Network, I'm Crystal Paco.